to Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson. Today's show is going to be about the top 10 reasons that people in the mental health field are considering leaving. And I wanted to highlight that today, primarily from a discussion that I had with a dear friend who's in HR. She owns a boutique HR firm. It's Talitha Beverly. And her question was, why is it so hard to find mental health therapists who bill insurance? And so that's what's inspired this show today. So let's begin to get right into it. I have the top 10 reasons, and we'll see if we can get to all 10. If not, we'll cover the rest on the next episode. Okay. Number 10, moral injury. So what is that? This is when there's a feeling of being unable to give your best, when you're trying to balance what are best practices, the insurance mandates, having patient loads, and high stress environments. So it truly becomes a moral injury because there are all these things, these competing priorities, and we begin to develop a damaged sense of self because we're unable to meet all these needs. Because at the heart of providing therapy is service and a desire to help others. And when a therapist feels like they're failing in some area or not being able to serve in a matter of excellence in which they are used to doing, it becomes very difficult to want to continue in that vein. Next, we have number 9, which is 6 systems. And so when we talk about 6 systems, mental health is often fueled on overwork and exhaustion. There is a constant tension between how do you balance revenue goals that are sometimes set by systems, and sometimes we even recreate those systems when we develop private practices. So when we consider those revenue goals set by those systems and we try to engage in emotional and physical wellness. Because when do you decide whether the patient takes priority, whether the bottom line of the business or the practice takes priority, as opposed to your emotional and physical wellness? I remember very vividly that when I was in a large mental health practice, that we had a certain amount of money to make every month. And it was very daunting because that dollar amount meant me serving someone. And oftentimes I would have days when I'd have to apologize and say, excuse me, I need to go to the restroom because my schedule was so packed just to meet that revenue goal. And sometimes even though it was packed, I didn't always meet the revenue goal because of changing insurance payments, but we'll get into insurance payments later. And so when a clinician goes into private practice and develops their own system, they tend to only know the system that they've been entrenched in and just create the same sickness. And so they find that this practice that was created to be able to gain a sense of freedom and have some autonomy, that you don't have it, that they may actually even find that it's more rigorous to own your own practice because not only do you have to cover the overhead, but also to have a living wage. And that can become challenging, all while also serving if you don't have a bunch of clinicians underneath you. Let's get into, and I'd love to hear any clinician's experience. If you could put in the chat your transition from a large system to your own private practice, whether you found that it was just as exhausting or even more exhausting. And because maybe it's just the circle of clinicians that I'm aware of. Number 8, lack of modality freedom. So for modalities, I just said that. Excuse me. Okay. Number 7, lack of assurance accountability. So insurance companies, they have extreme variations in the rates of reimbursement. And many times it's inconsistent timelines for reimbursement. There's difficulties in processing. So let me back up to extreme variations in rates of reimbursement. I can remember when I was doing private practice, there was one EAP company that wanted to pay $30 an hour for a client. Yet I'd have another company who was paying $125. So it's very unpredictable when you have such a wide range of how to serve and support. And I mentioned inconsistent timelines for reimbursement. Some want the claims to be processed right away, and some you have up to a year or 60 days to be able to process it. So trying to keep track of all of that and making sure that it's timely can be very time consuming and a lot of administrative overhead to be able to serve and support clients. And if you are being the butcher, the baker, and the candlestick maker in your practice, that just wears you out. Or either you need to pay someone to do it, and then that's another draw on your revenue. Sometimes difficulties in processing, whether it's the payment processing system or different changes in regulations or what type of modifiers you need to put on there, that can be a daunting task, as well as dealing with large EAPs and a variety of different rules that really make it challenging to be able to focus on client care. Number 6, lack of advocacy from professional organizations. So what we found is that while professional organizations do advocate in some areas, their priorities are not always the priorities of many of the clinicians. They don't advocate in the government sometimes or with insurance agencies where we'd really like it to be for some standard rates of pay, not only by profession, but the type of service. And many times the agencies don't focus on practice protection to prevent, and dare I say this, to prevent coaches or lay people from using terms that are clinical. That's why we have so many mental health coaches out there or trauma coaches, and their only training sometimes is just a certification program. And not downing a certification program, but therapists, psychologists, those in mental health field, psychiatrists, they've gone through extensive training in their schoolwork as well as continuing education training every year just to be able, and that's just meeting the standard. That's not exceeding the standard. So some have to renew every 1 to 2 years, some a little more frequently or less frequently. But they put a lot of effort into that. And it would have been really helpful if there were some restrictions on who could use some of those terms about what they do in the profession. Because what I'm finding is that a lot of people who were clients who were confused about what is the difference between the various mental health professions. So a licensed mental health clinician as opposed to a licensed marriage and family therapist or a licensed professional counselor or a social worker or a psychologist and a psychiatrist. Oftentimes I would spend time educating them on the difference between the professions and how they could serve and support. And then when you add that next level of coaching, and let me not even say next level, we add another entity or another profession with coaching, it's very confusing, especially when you have a lot of social media out there. And what I've noticed a lot from the public is that what these coaches, they are getting a lot of airtime, a lot of recognition because popularity is being mistaken for professionalism, a something that that they know more because more people are gravitating toward them. And sometimes it's just a matter of having a more charismatic personality. All therapists aren't charismatic. A lot of them are just very professional and um, very tactical and very knowledgeable in the craft that they've honed. It's been very interesting for me to see the large followings that of people with narcissistic personality disorder, at least that's what they say they have. They're marketing themselves as how to identify and spot a narcissist and how to um, deal with a narcissist. And the irony is that everyone is just feeding that narcissism because the following gets larger. So that's been really interesting to watch. And keep in mind, I'm not diagnosing these people as being narcissists. They are saying that they are diagnosed narcissists and telling people how to deal with narcissism in a partner. Now, let's get to, so you can tell I spent a little time on that one because I'm a little more passionate about that practice protection and what our professional organizations could be doing to serve and support us better. And the next big thing, burnout. It's another reason that clinicians are thinking of leaving the field and those in mental health. So when we talk about burnout, and I'm not going to get into all the 12 stages of Dr. Herbert Freudenberger's conception of burnout, but some of the things that contribute to that for a clinician, being overscheduled. I can remember being in community mental health, and at times I would be scheduled every 30 minutes, even though I was seeing clients for an hour at a time, to account for attrition or people rescheduling. So what would happen is there'd be sometimes when everyone shows up, because that does happen, right? Everyone decides to keep their appointment that day, then there are people waiting and being irritable. And so I can't serve them well, and I have to be apologetic because we were overscheduled. Compassion fatigue. No one goes into counseling for fun, grins, and giggles. We enjoy serving and supporting others. We have a heart to want to be able to help people get to a place where they feel healed. And so that can be very draining on your mind, your heart, and your spirit. So continually feeling compassion for others and hearing all of these challenges and struggles that they have. And if they aren't taking care of themselves or have some type of outlet, that begins to weigh on you year after year after year or month after month. Some clinicians don't even make it past their first year because sometimes the compassion fatigue is so challenging and or vicarious trauma. They need to leave because of that. Health struggles. So one of the things, because we are serving and supporting and you need to make these revenue goals, you don't always have time to schedule a doctor's appointment for yourself. And what we find is, unlike the mental health profession, medical appointments aren't always rigid and on time. Whereas you believe that, okay, my appointment is at this time, it should take about 30 minutes. No, it actually takes an hour and a half, which means that you've lost 1.5 clients. If you support more, maybe 3 clients. So that impacts the revenue goal, as well as someone is not getting treatment. And it's very difficult to be able to support your health. Um, and not only the health struggles because you're trying to find time to take care of your physical health. Some of us don't have health insurance, especially if they're in private practice and they're single, or their mate or partner doesn't have health insurance. So they wait until the problem is big enough or bad enough, or it's an inexpensive problem. Depression. Yes, clinicians do suffer from depression at times. So that can be a factor, and it's important that they not be impaired professionals, but actually take some of their advice and take care of their health. Exhaustion, we talked about that before. That's a big thing, trying to keep up with notes, requirements from insurance companies, requirements from the practice, from an organization, sometimes also providing clinical supervision, and just overwhelm. One of the things that we're finding is that since the pandemic, post-pandemic, there are so many people who are now discovering mental health, and but they're bringing with them years of trauma, years of challenges, and they want to be able to fix it quickly. And so hearing the burden of all of that, and hearing complex bereavement, complex trauma, um, severe abuse over and over again begins to feel overwhelming. It's a huge responsibility. So all of these play into the experience of burnout. Next, we have number 4 we're on is professional and personal growth. So the changing relationship with work in the profession um, makes it so there's a desire to be collaborative. And many times, if you are in a private practice, it can be very isolating when you're in that role. And you don't have someone to bounce those ideas off. Or even when you're in a very large practice, an organization or community mental health, because you are seeing so many clients back to back to back, there's very little time to consult with others, or just to, sometimes they don't even get lunch. And so having the ability to be able to share some of your challenges, burdens, or wins with other clinicians is sometimes very few and very far in between. Um, they want to have new challenges. So at times, if you focus on a certain disorder, or your clinic focuses on a certain disorder, the way to treat people almost becomes like a wash, rinse, and repeat. And they want to find something new, or they wanted to challenge themselves, have different type of diagnoses, different type of populations they may want to refocus. And sometimes it's difficult to shift, as sometimes that requires different marketing. If you're in a different area, possibly expanding with telehealth, all of these things contribute to it. Many are seeking at times a different organizational structure. That's what they're missing, or it may be that they are in a chaotic organizational structure, and it makes them feel like they're really not growing. Let's get to number 3, restrictions and oversight. This is a big reason why clinicians sometimes want to leave the field, or people in the mental health. So many times there are restrictions based upon regulations from licensing board, like what is your scope of practice, what are the types of roles, Sometimes it creates a sense of a lack of freedom. Um, and I can vividly remember when I first started doing counseling in the state of Georgia. I haven't been to Georgia in a while. But if we needed someone to be, and the term is 5150 in Georgia at the time, if we needed them to be placed in a mental health facility for their own safety or the safety of others, only licensed clinical social workers could sign off on that, or a medical doctor. So even though a clinician may be very experienced with diagnosing, spotting someone who is a harm to themselves or harm to others, they are limited in actually ensuring that that process can occur because of their licensure. Um, Sometimes the type of roles are restricted. At times, some organizations may only want to hire, okay, this profession because we believe that this organization has advocated and said only these type of clinicians can engage in this role. So that can be very frustrating, especially when you may have a desire to enter into that part of the mental health field, or you have had prior experience in that, but you go to a different state and find out, well, no, you can't do that role here. And one example I will give on that, I know in the state of California, licensed marriage and family therapists have a wide berth. It's very highly respected. We have a lot of authority and ability to support a variety of different organizations. So when I came to the Southeast, that wasn't the case. And there were so few LMFTs, it was very surprising to me. So the other thing is that there are often restrictions on the type of marketing you can do, what type of incentives you can provide to clients, and frustrations with the lack of restrictions in the coaching field also uh, play into that as well. Another thing that we're finding with clinicians, this is number two, is low pay. So I mentioned previously that there was this wide difference between um, what insurance companies can reimburse. I don't know if you remember, I said $30. There was a difference of, there was $30 for the same service by one insurance company, and another insurance company would pay 125. So with low pay, sometimes now clinicians are having to compete with AI bots. I think one of the companies is Wobot and Simi, and there are some others. So they are providing telemental health. And of course, there are some caveats that this is not a mental health therapist, but people are finding these organizations, and it diminishes our ability to get the pay that mental health people deserve. Um, Telehealth across state lines is often limits on marketing strategies, insurance requirements. I was recording. I was just about to finish. And now we come to number two, low pay. This is another challenge for people in the mental health profession. We're finding that pay is often impacted not only by, there's limits on the type of marketing that therapists, psychologists, people in the mental health field can do. And so we don't have all the tools and techniques that coaches might have, or people who claim to support those with mental health disorders. We have certain restrictions in our ethical codes that prevent us from doing certain types of marketing that tends to attract larger amounts of people. So we don't get to those people through some of the traditional means that others use. There's also pay being impacted through competition with AI bots. We're finding that those in the general public are sometimes attracted to, I think one is named Wobot or Sini. They're choosing some of these things, which can definitely impact our pay as well. Um, let's see, low referrals. Sometimes it's often considered an expendable item, people's mental health. Do they want to pay the light bill, or do they want to go to therapy? So many times it is the first thing that gets cut on the budget. And to compete with that, or to continue to attract or retain clients, some clinicians feel compelled to reduce their fees, offer sliding scales, not because someone's inability to pay, but just because they fear losing people unless they make themselves as affordable as some of these AI bots or other things that are available, friends, companions, companies, and coaching companies, um, because it's considered an expendable item, and we undercut ourselves to be able to preserve the clients that we do have. And lastly, the number one reason, and I'm just listing these aren't necessarily in hierarchical order, but these are some of the reasons that clinicians and other people in the mental health field tend to want to leave. Experiencing clinical overwhelm. And I mentioned this briefly previously, but when you have clients with multiple complex crises that have been unaddressed for sometimes decades, and to be asked to develop a treatment plan and help them undo some of the things that they've been doing for years, habits, behaviors, people they hang around, it can feel quite daunting to have a hand in being responsible for that, especially if they are taking more ownership over the client's issues than is necessary or even healthy. Um, Sometimes clinical overwhelm also comes from having multi-generational trauma. So getting clients who were born into a sick family system or unhealthy family dynamics, and we're trying to undo years of thoughts, beliefs, behaviors, because it's coming up as pathological for them. Not that we are saying that they need to be a certain way, or their beliefs need to be a certain way, but there are dysfunctional behaviors that can be seen multi-generationally. That's a little bit of a tongue twister there. And when there's clinical overwhelm, when you have these clients with these multiple complex issues, some begin to question whether they have the knowledge and the expertise to even be able to treat and serve these clients. And yes, it's absolutely healthy and a good idea to go back and get additional continuing education training for these type of clients who bring these challenging situations. But as with anything, it takes time to become an expert in that. When you first learn something, you are trying. And if you don't have someone to guide you, or if you're not in a practice where they take the time to allow you to get that clinical supervision so that when you don't understand something or you're having challenges getting the desired outcome or helping clients reach their goal, it can become very overwhelming, confusing, frustrating, and no one wants to feel like they don't know what they're doing or that they are causing clinical harm to a client because they're overwhelmed because they feel like they don't have the competency to serve in ways that they'd like to serve and support clients. So what we've done is we've laid out 10 possible reasons that clinicians or those in the mental health field are choosing to leave or choosing not to serve or take a break from the profession. This isn't an exhaustive list, and I'd be very curious to hear some of the other reasons that you think maybe why some people in the mental health field are deciding to leave due to burnout, or even if you disagree with some of these. I would love to hear some of your feedback on this. And until next time, you can always catch me here at Leadership Beyond Burnout on Thursdays at 5 p.m. Eastern, 2 p.m. Pacific, right here on E360 TV on the Vitality Network. And until next time, I shall see you then. Thank you for tuning in.